Hello there, I'm James Bays at UN headquarters in New York. Now, this is a building I work in most days, and I have to tell you, it is very eerily quiet now. Normally, there's about 10,000 people come into this compound every single weekday. Now, at the moment, there's only about 300 people accessing this building every day. They are the skeleton staff, most of them working, trying to get the video conferencing systems working to allow the rest of the UN to continue its vital functions, those peacekeeping missions mainly in Africa, and the humanitarian agencies of the UN that are helping the most vulnerable people on Earth. It's worth telling you that the UN is most worried about those people, about the refugees and those living in conflict zones. That's why one of those who has been coming to work here every single day, the UN Secretary General, has launched a $2 billion appeal. I asked him about it. You've launched this global humanitarian appeal. Tell us what is at stake here and how many lives could be lost if the world doesn't act to help the most vulnerable countries, the refugee camps and the conflict zones.
Well, this is exactly an appeal for that. It is a humanitarian appeal for those countries in conflict, for those fragile states, for refugee camps, internal displacement camps, that have dramatic humanitarian needs that need to go on being met, but on top of that have now the threat of COVID-19. And we need to do everything to prevent the disease to come to those areas to the extent possible. And at the same time, in those areas you have people sometimes in slums of big cities or in camps in which it's very difficult to have isolation. There is no water in the households, sometimes no soap. Healthcare facilities are extremely rudimentary. So we need to boost the response capacity in those areas. That's why we have asked, and we mobilized all UN agencies, the Red Cross, Red Crescent Movement, a large number of NGOs. We mobilized all to work together, and with those funds, with those $2 billion, to make sure that we are able to have a strong push for prevention in those vulnerable areas, and at the same time to bring the equipment that is required, ventilators, tests, suits for the staff to allow for contact with people impacted, masks, and then water and sanitation in key areas for people to wash their hands, soap, medicines, and all the other aspects that are essential for healthcare systems to be boosted and to have a minimum capacity to respond to the needs of these peoples. Now, if this won't happen, if we allow the disease to spread like wildfire in the developing world in general, and in these parts in particular, we'll have millions and millions of people infected. We can have millions of people dying, and even for those that sometimes are too egoist and think why to support the developing countries when we have so many problems at home in our own rich countries, I would remind them that if this spreads like wildfire in the south, there will be massive transmissions that makes the mutation of the virus even more easy. And so there is a risk that the virus comes back to the developed world even after vaccines have been developed, when the developed world thinks that all is over, and then everything will start again.
Secretary General, we're both in the same building right now, but we are conducting this interview remotely for obvious reasons. You're living in New York. It's eerie right now. It's worrying. Yet this is one of the richest cities on Earth with some of the most sophisticated medical care. If they're worrying about how they can cope here, what chance do some other places stand in this?
I do believe that it depends on how soon you attack the COVID-19. And if you attack COVID-19 soon enough, you will be much more able to respond effectively than when we are already in the epicenter of the pandemic. And so our main concern in relation to those areas, most of them are remote areas, many of them have not yet been touched, is to put an enormous pressure on prevention and on make sure that we control the beginning of a possible outbreak. What we are witnessing now in many developed countries is that they started too late, and now even relatively sophisticated health systems are unable to respond to the very dramatic impact of the disease. We need to act, and we need to act immediately to be able to avoid the worst.
You've called for a global ceasefire in conflict zones, but let me give you a couple of examples. In recent weeks, things have been going in the opposite direction in some of those conflicts. Let me ask you how worried you are about the increase in hostilities in Yemen.
Well, I am, even if one of the most important movements in Yemen has declared that they would accept the ceasefire or that the appeal of ceasefire. We have other armed movements in other parts of the world saying that they would be ready to abide by it. All our special representatives and envoys everywhere in the world are pushing to make sure that this appeal is translated in diplomatic action, bringing together the parties to the conflict for the ceasefire to become a reality. We have had initiatives in Syria, in Yemen, in Libya, in many other parts of the world. And I hope that this appeal will be heard and that people will understand that there is only one war that is necessary today. It's a war against the virus.
You mentioned Libya there. There was already supposed to be a humanitarian pause in Libya, but one side has not been respecting it. General Haftar in recent weeks seems to have intensified his campaign. What's your message to him?
This is the moment to stop all military action. This is the moment to concentrate on fighting COVID-19.
We're already seeing COVID-19 cases in Gaza. You've been there, you know, it's one of the most crowded places on earth. How are you supposed to self-isolate if you're someone living in a place like Gaza?
Well, it is extremely difficult, but the same applies to the slums of big cities in different parts of the developing world, to refugee camps. It is much more difficult, and that is the reason why we massively need support for those areas, and we massively need to increase the capacity to respond, and the health services that are so weak in those areas need to be very quickly boosted. And of course, water and sanitation programs of all kinds of improvement of the other humanitarian dimensions are absolutely crucial to minimize the negative impact.
Many cities around the world are on lockdown. In those places, the medical advice is very consistent. Do you believe that citizens, and for that matter, political leaders, who ignore that advice are being irresponsible?
I think we need to have a coordinated action of all countries, and I believe the G20 will be an opportunity to do so. All countries need to have a common strategy, and that strategy is not a strategy, in my opinion, of mitigation, is a strategy of suppression of the virus. Now, for that, you can combine different ways. You can, if you have a huge testing capacity, and if you have a very strong tracing capability and quarantining all the people detected, like Singapore has done, you need less restrictive measures in relation to movement and in relation to contact. But if the testing capacity is limited, then you really need to severely limit movement of people. You really need to severely limit the capacity of contact. And not to recognize this is, in my opinion, putting the countries at risk of the disease spreading like wildfire. And if the disease spreads like wildfire, the consequences will be absolutely devastating. We need to understand, of course, we need to understand that people are concerned with the economic impact. But that is why it is so important to have a massive mobilization of financial resources. That is why it is so important to guarantee that beyond maintaining liquidity in the financial systems, there is a massive support to households to keep them afloat, to businesses to keep them afloat. And a country like the United States, for instance, that you just mentioned, is discussing a package of $2 trillion, which comes close to the two-digit of percentage of the economy that I've been mentioning several times is needed to make sure that you can combine very drastic restrictions of movement with, at the same time, keeping the people, the businesses afloat and allowing for, when you are successful in suppressing the disease, for a recovery, a quick recovery of the economy.
You mentioned the US and you mentioned the G20. President Bolsonaro of Brazil is saying there is hysteria. President Trump is talking about opening up the US economy by Easter. When people are passing the message, doctors stay at home, are these sort of messages from political leaders unhelpful?
I think that it is very clear that we need to be able to suppress the disease. And obviously, the time framework to suppress the disease might be different from country to country according to the measures that are putting into place. But without suppression of the disease, we'll risk the spread like wildfire. We'll have millions of cases, and with millions of cases, we can have millions of people dying, and this is something that we absolutely need to avoid. And so my message to all leaders is concentrate your efforts on suppressing the disease and concentrate your efforts in rescuing the situation of people and businesses for your economy also to be able to survive and then to recover when the time comes.
Well, you heard the Secretary General there talk about that $2 billion fund for the most needy around the world. The man who will administer that fund on behalf of the United Nations is the Emergency Relief Coordinator, Mark Lowcock. I've been speaking to him.
Well, this is to get going with the response to COVID-19 in about 40 of the countries which are going to be most vulnerable to it, those which already have huge humanitarian challenges like Syria, Yemen, Afghanistan, Somalia, and so on. And we're going to do a bunch of things. Firstly, we're going to scale up testing, the provision of equipment, other medical support. Secondly, we're going to scale up water and sanitation and hygiene programs, as we know that one of the ways people can protect themselves a bit from this is by having good personal hygiene. We're going to scale up information, particularly on social distancing and all the other things people can do to protect themselves from getting the virus from other people. And then another really crucial thing that we're going to do is try to compensate for the declining availability of commercial airlines by scaling up the operation of the UN's own humanitarian air service. There are thousands and thousands of aid workers who we can put to work on this problem in those vulnerable countries, but we need to be able to get them and supplies and equipment in and out.
How difficult is it going to be for you to get the kit that you want? Because many governments are finding it hard to find the masks, to find the gloves, to find the tests, to carry out tests, and also, of course, to find ventilators.
It's going to be a huge challenge. The World Health Organization has already sent test kits and personal protection equipment to dozens and dozens of countries. They are being resupplied by some of the producers, and we're going to do everything we can. But there's no getting away from the fact that if the countries with the world's best health systems are struggling with all those things, it's going to be commensurately a much, much bigger challenge for the countries we're talking about in this appeal.
How worried are you about the world's refugees?
Well, refugees are an extremely vulnerable group of people. Our appeal covers all of our refugee programs. They're often in very densely populated places like Cox's Bazar in Bangladesh, where all the Rohingya refugees are. We've prepared lots of new guidance to all the aid agencies on how to do the best they can to cope with dealing with the threat COVID-19 poses in refugee settings, but it could be a very, very difficult challenge indeed.
How worried are you about conflict zones, places like Syria, like Yemen, like Libya?
Again, there could be huge problems there. That's one of the reasons why we call for a global ceasefire. Every country in the world needs to fight the war against COVID-19, to put down the guns and the bombs and deal with this bigger, deadly enemy. It'll be much, much harder to mount a response if that doesn't happen. People need to come to their senses. In some places, we are seeing a reduction in violence. In northwestern Syria over the last 2 or 3 weeks, for example, there has been a reduction in violence, but everybody else needs to get the message the virus is sending. Where you talk about Libya, we're also very worried about the situation in Yemen. Anybody with influence over any of the warring parties needs to encourage them to understand what's going on and how what they're doing if they perpetuate the conflict is an enormous act of self-harm. They're going to be damaging themselves and their own interests if they don't get involved in a proper ceasefire.
The UN is all about a multilateral response to things, getting the richer countries to help the poorer ones. But right now, every country seems to be just focusing alone on their own problems because they are so severe.
And it's right that every country focuses first on its own problems. It's entirely right they do that. But it's also right, and actually the most intelligent, smartest strategy, to do a little bit for those countries which are going to find it hardest to cope. Because the truth about this virus, this disease, is that nobody is going to be safe until everybody is safe.
As I continue to walk around this virtually empty UN compound, only a skeleton staff working in this building, in fact going through a security checkpoint at the moment with the automatic doors because there are no staff here, it's worth reflecting on some of the most overcrowded places on Earth where people are the most vulnerable. And I'm talking about refugee camps and places where there are displaced people, particularly conflict zones. The man who's in charge of dealing with those problems is the UN High Commissioner for Refugees, Filippo Grandi. Let's first talk about refugee camps and those refugee camps where your organisation helps run things. What are you changing in those camps in terms of social distancing, and how do you achieve social distancing?
The margin of maneuver is relatively small. These are very overcrowded areas, which, by the way, like in many overcrowded cities in poorer countries, in these situations, social distancing will be a big challenge. So what we are trying to do where we can, where we have space, which is not always the case, is to build additional structures, say for quarantine purposes or for screening purposes, should an outbreak hit any of these situations. I hasten to say, so far we have not seen major outbreaks, thank God, but we need to be prepared for that. And then, of course, we are multiplying other interventions. We're trying to improve water supply, sanitation systems, and of course, we need to also equip humanitarian workers to be protected in delivering their services. We are used to working in difficult, insecure, dangerous situations. We've even been involved, many of us, in countering Ebola and other epidemics, but never on this global scale. We have a financial appeal for additional resources, which we hope will be met generously by donors.
So what are your contingency plans if there was an outbreak in a refugee camp? Would you consider trying to evacuate everyone?
In many cases, this will be absolutely impossible. And therefore, we will have to operate where the people are. Now, the most important thing to say here is that, of course, this is the responsibility of the host governments. They have to make sure that refugees are included in their responses. Because, by the way, in many, many places, it's not just about refugees. It's about the local population that lives in equally crowded spaces in the same areas. So we're working with governments. We're working with governments to strengthen their response, to get ready for possible outbreaks. And this, like I said, includes all aspects of the response.
Many of the people you deal with are displaced people who aren't in formal camps. And one thing that comes to mind is the advice you keep hearing from people: the best way to protect yourself is washing your hands. But one assumes many of these people don't even have access to clean water.
This is why it is so important to strengthen government systems. Humanitarian assistance will be important, crucial, for the extra mile that we have to run in responding to possible outbreaks in fragile situations. But what is really important is the assistance that institutions like the World Bank, other financial institutions, bilateral donors are provided to governments to strengthen their response systems. If I think of what I saw in places like Kaya and the incredibly crowded parts of the city that I visited, with women and children in particular, camping out because there was simply no shelter, I really tremble to think of what may happen if the virus creates havoc in this particular situation. This type of situation, and Burkina Faso is by no means the only one, will really become a liability for the people living there, first and foremost, for the host communities, for the entire countries, but also regionally and globally. If you take Libya, but not only Libya, Syria, Yemen, Afghanistan, parts of Somalia, where conflict traditionally has been an obstacle to the delivery of humanitarian assistance, then the situation becomes even more complicated. This is not just a matter of having to help people that live in crowded areas where there's no escape to social contact or where water is scarce. But in addition to that, you have fighting, preventing humanitarian aid to reach these people.
Clearly in Syria, healthcare facilities have been bombed and there's a real difficulty getting things across the border. Again, in Yemen, very difficult to cross lines with vital supplies.
Without cessation of hostilities, without at least a ceasefire that the Secretary General is calling for in those situations, it will be impossible to stop the pandemics in those countries. You know, one important point that we have tried to make to donors is that as you hopefully allocate additional resources in these countries to help us counter the pandemics, don't let go, don't lower your guard, don't drop the ball on existing humanitarian and development programs, and in particular, humanitarian programs. I've had discussions with donors, for example, on education programs. Some donors say, well, you can't really continue to do education. We have to divert all the resources to health and sanitation. And I would argue, no, we need to keep those investments, including in education. How can you do proper health education if you don't have education structures and programs? Everything is interconnected, so we need to sustain the ongoing humanitarian efforts, and we need to add on additional resources, I'm afraid, to counter the specific threats posed by the pandemics. You know, once again, it's the same thing that we say all the time, we in the UN, about other global phenomena, about the climate emergency, about refugees and migration, about poverty. If we don't work together, these problems will come back to haunt us over and over again. And sometimes, you know, we may think that these problems are confined to certain areas. They don't concern us. Well, this pandemic show that it concerns each one of us as we speak in our own safe homes.
This is a very difficult time for the UN. The world of diplomacy works face to face normally, and it's clear that the institutions of global leadership and cooperation are somewhat paralysed by all this. Partly because the UN is based here in New York, and that's the epicenter of the virus in the United States. It's worth, though, now at the end of our programme, looking forward to beyond the time when we're fighting this virus and to look at the way the world of work will change. Here in the UN, this is the Al Jazeera office. I'm working on my own, everyone else working from home. I asked the Secretary General how he thought things would change in the future. Obviously, we are currently looking hour by hour, day by day at fighting this disease. But can I ask you to look at when this is over? Do you think it will change the way the world works?
I think that there will be enormous inevitable changes. First of all, this is becoming largely a digital world with a digital economy. And I believe that there will be a huge boost in all aspects related to cyberspace, artificial intelligence, to all the virtual forms of transaction and all the virtual forms of contact. And so the world will inevitably change. And I don't think we should fight climate change with a virus. But I also believe that there will be an opportunity to recover the economy with a much more sustainable and the inclusive approach. And this will be an opportunity we should not miss. Of course, emissions are now going down, but if we go on in the future repeating the same mistakes, they will go up again, and we'll be facing exactly the same dramatic situation of climate change. So let us make sure that when we recover our economies, we take profit of everything we learned with the crisis to make the global development strategy much more inclusive and much more sustainable, and to make climate change the priority that has always been.
Secretary General Antonio Guterres, thank you for talking to Al Jazeera.
Thank you very much. It was a pleasure.